My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
Are you high pitch voice problem?
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Girlish from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live, and today we are before treatment live with Ivan, and today date is 10th April 2023. Ivan is not from India and he is from Europe, Bulgaria, and in the future we will be doing post-treatment live. To watch that, please subscribe our YouTube channel and don't forget to watch his post-treatment live. And in this live we are going to discuss few points, and that I am going to just tell in advance. So first will be introduction about me, our center, our YouTube channel, and then you will be listening the Ivan's voice before treatment. And before starting the speech therapy, voice therapy, what are the information required, especially if you are staying in India or taking speech therapy or voice therapy from Indian speech language pathologist. And then we'll be talking on high pitch voice signs, symptom, cause and treatment. And I'll be talking in this live, is there any side effect of voice therapy or self-treatment? And I'll be also talking how to contact us. Next will be, do we have accommodation facilities at our center? Kind of services we provide? Which treatment is preferred first, voice therapy or surgery for pitch correction? And do we have any branch of our center? We'll be talking. Next will be cost and duration of treatment for voice and speech disorder. After that, I'll be talking on how do we treat international patient, online or offline. Next will be, is saying 1, 2, 3 or saying in new voices the stage of treatment or end of the treatment. Next will be, is voice therapy result is permanent. Then I'll be talking effect of food and drink on voice. And then I'll be talking who are the good candidate for the voice therapy. Next will be, is all high pitch voice or female voice is Puberphonia. Next will be online facilities for communication disorder at our center. And then I'll be giving few tips to keep your voice healthy for those who are having communication disorder as well as those who are not having any communication disorder. For both of them, that will be useful. And next will be replying the question from the live chat. So let's go one by one. So first is introduction about me. So my name is Sanjay Kumar. By profession, I am speech language pathologist and audiologist. I have studied from AIIMS, Delhi, All India Institute of Medical Science, New Delhi. From there, I did my graduation in the speech and hearing science. My bachelor degree name is Bachelor of Science Honors in Speech and Hearing. Now this degree, based on the Rehabilitation Council of India's recent information, it's also known as Bachelor in Audiology and Speech Language Pathology. It's called BSLP also, but previously it was known in AIIMS, that goes Bachelor of Science Honors in Speech and Hearing. And my master degree name is Master of Science in Speech Language Pathology, and that I got from University of Mysore. and my institute name was All Indian Institute of Speech and Hearing, Mysore. So why I'm telling all this degree and all, because there are some healthcare quacks, they will be also claiming they are a speech pathologist and audiologist. So this will help you to understand the difference between healthcare quacks and the real professional. And speech language pathologist will be also certified, means having the certification from Rehabilitation Council of India. So I'll be telling you how to find that also in this live. Means how will be knowing that who are the real or who are the fake, especially in Indian context. So this is the small introduction about me, and my area of interest is treating voice disorder. So by profession, I'm a speech pathologist and audiologist both. I do hearing testing, hearing evaluation, hearing aid fitting, but my more expertise and my center is famous in voice disorder. And our center name is Sanjay Speech, Hearing and Rehabilitation Center, that is located in Bangalore, and it's a 30 minutes drive from Bangalore International Airport. And the location is already mentioned in our website. Our website will be able to find in description of this video. And our YouTube channel name is SLP Sanjay Kumar Voice Therapist, that we started in the year 2010, and with the pre and post voice therapy videos with the success stories of the patient having different communication disorder, we are creating the awareness across the globe, and our client list include all the continent of this world. So this is the small introduction about me, our center, and our YouTube channel. And next is you will be listening patient's voice. So first I'll be asking Ivan, just tell us exactly, unmute your mic, what problem you are facing and why you contacted us. And today we are live before treatment. In the future we are going to be the post-treatment live. So unmute your mic.
Yeah, hi, my name is Ivan. I have high-pitched voice. That's why I contacted Dr. Kumar. As you know, this condition is very frustrating. Sometimes it can literally ruin your life. You know, there is so much feeding, mocking sometimes, and it's really hard. And I really hope that I can hear just a normal voice.
Where you stay? Where you stay?
I live in Bulgaria, Eastern Europe.
Okay, you can mute your mic now, and I'll be explaining what are the information required before starting the speech therapy, and how you'll be able to find who are the fake and who are the real speech language pathologists and audiologists, especially for the Indian context. So before starting the speech therapy, first you should try to find out what degree your speech pathologist or audiologist is having. What is the full form of the degree? From which speech and hearing college, which medical college he got the degree, and what is the full form of the degree? And most important thing is the which year. Sometimes healthcare quacks will tell that fake degree and the fake college also, but they will not be putting the in which year they got the degree. They will be scared because their classmate and all the university will be able to find easily to them. So they will be scared. And another thing is you should find if he is from India, he is registered in the Rehabilitation Council of India or not. So that I'll be giving step by step how to find out. So those who are watching this live, please connect it with us. I'm just going to show how you can find out who is fake and who is real. So in the Google search, you can write Rehabilitation Council of India. Just I'm showing Rehabilitation Council of India. So click that Rehabilitation Council of India, then you'll reach to this website, and then you can go to the registration. There you will find first one, registered with us. That one you can click. Now you can click this one. Click for registration detail of registered professionals. Now you'll be the click to search by name and click to search by CRR number. So all the speech language pathologists and audiologists, those who are registered in the Rehabilitation Council of India, they will be having the CRR number. And of course, some speech and hearing technicians, psychologists will be and special educator will also having the CRR number. So you have to click to search by CRR number. And now you can put the CRR number provided on the website, on the social media by the speech pathologist and audiologist, because those who will be fake, they will not be giving you the information about the CRR number. So enter the CRR number, because with the name, if you'll be searching, it takes more time and sometimes it doesn't work, I have seen. So put the CRR number provided by the speech pathologist and audiologist. And once you'll put the CRR number, you'll find all the details of the that professional. So also check that he's registered as a speech and hearing technician or psychologist or a special educator or a speech pathologist and audiologist. So once you put the CRR number, so this is the best way to find out. And even you can find my CRR number also. If you'll go to the community page, any post, I have given my CRR number also. So you can do the experiment with that one. And the similar experiment you can do with the other professional also, those who are claiming that they are speech pathologists and audiologists. So in that way, you will be able to find out who are the real professional and who are the fake. Because once you are registered in the Rehabilitation Council of India, you will be provided by the CRR number, RCI CRR number, and the fake people will never tell that they are having the CRR number, or sometime some fake people will, those who are not speech pathologists, audiologists, claiming that they are having the CRR number. So check that CRR number is as an audiologist and a speech pathologist or not. Sometimes the technician will also be there. So don't get confused that somebody is having the CRR number, it means he is a speech pathologist and audiologist. This is the way you can find out. And now next is kind of services we provide. To understand what are the services we provide at our center, those who are new at our YouTube channel, please refer the playlist of our YouTube channel. You will find different communication disorder playlists, and all the playlists will be having pre and post treatment videos, and that will give you an idea how much time it took to correct that problem. One thing, and the second thing, how much improvement was done after the voice therapy. So you'll get all the details. And just for idea, if you will explore our YouTube channel playlist, you'll find the playlist of high pitch voice, puberphonia, vocal cord paralysis, stammering, phonatory gap, sulcus vocalis, functional aphonia, functional dysphonia, misarticulation, after stroke, aphasia happen, aphasia, and after hearing evaluation and just after the feeding the hearing aid to the right candidate, how the communication improves. This kind of video you will be able to find at our YouTube channel's playlist, and that will give you an idea how a certified speech pathologist and audiologist changes the life of people having communication disorders. So this was the information about kind of services we provide. And next is high pitch voice sign, symptom, cause, and treatment. So that is most important. Many people will be waiting for that. So high pitch voice sign. So after puberty, the voice should be having the masculine voice, because before puberty there is no much difference between male's voice or female's voice. But during puberty, the vocal cord mass length increases, pitch reduces. So the boy's voice will be more masculine and more low pitched. So especially after puberty, if you are calling to somebody on the phone, people will be saying, yes, ma'am, and they are thinking they are talking to a small child or they are talking to a girl. So it may be the symptom of puberphonia or high pitch voice. I have seen many patients will say that when they will order some food, something on the other part of the customer care people, those who don't know, they will think they are talking to a female. This happens mostly. So this is the very simple way to know that. And next, high pitch voice sign, symptom I told, and cause and treatment. So before discussing cause and treatment, I will love to discuss the normal speech production mechanism. Once you know the normal speech production mechanism, it will be easier for you to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. These are known as articulators. So once you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. And in one sentence, there are so many words. In each word, there are so many sound. Each sound is own place, own manner of articulation. So it is a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles will not be there, there will be another communication problem, stuttering or stammering, fluency issue will be there. But so here we'll be more discussing about the pitch problem. So as I told, here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So before puberty, there will be no much difference between the boy's vocal cord or the girl's vocal cord. But during puberty, in case of boys, due to a hormone called testosterone, vocal cord mass will increase, length will increase, and pitch reduces. So in a very simple way, before puberty, the vocal cords in case of boys are thin string of a guitar like a structure. But during puberty, due to the testosterone hormone impact, the vocal cord of the boys will become thick string of a guitar like structures. So if you have seen the guitar, thin string produces high pitch voice, thick string produces low pitch voice. So due to the testosterone hormone, vocal cord has become thick in case of boys. For example, those who are having the Puberphonia. Now the vocal cord is ready to produce the low pitched voice, but because of so many years habit, that boy will not able to switch on to the new voice. So what he will do is to maintain the older voice, means maintain the childish voice. Instead of vibrating the whole mass and the whole length of the vocal cord, he will start vibrating thin edges of the vocal cord. Why it happens? Because that child has used the high pitch voice from so many years, from childhood to till puberty, and now during puberty the vocal cord mass length has increased due to the hormone testosterone. It is ready to produce the low pitch voice, but because of so many years habit, he will not able to switch on to the new voice. We can say the reason may be slightly psychological as well. So what he will try to do, he will try to maintain the childish voice. So to do that, what he will do, instead of vibrating the whole mass and the whole length of the vocal cord, he will start vibrating thin edges of the vocal cord. So he will be able to produce the childish voice, because he wants to produce the childish voice unknowingly. So what I do as a speech language pathologist, I don't replace the larynx, I don't replace the vocal cord, I don't give the new larynx and new vocal cord. So what the vocal cord is there, the child is producing, or the person is producing only vibrating the thin edges of the vocal cords. So in that case, what I will do, I will stimulate whole mass and the whole length of the vocal cord. So the patient will start vibrating, instead of thin edges of the vocal cord, will start vibrating whole mass and the whole length of the vocal cord. So the vocal cord, which was behaving earlier like a thin string of a guitar like a structure, will start behaving like a thick string of a guitar like a structure. And when the guitar string will be the thick, the pitch will be lower. So this is the biophysics behind that. And if you want to go in a little more depth, in acoustics there is a one relation in the physics, if you have studied, there is called like n is equal to 1 by 2l under root t by m. Here n is the frequency, and 1 by 2l, L is the length of the vibrating string, T is the tension of the string, M is the mass per unit length. So if any string vibrate, the relation between frequency, mass and the length and the tension I have told. So again the formula is N is equal to 1 by 2l under root T by M. So before puberty, the vocal cord mass and the length will be less, the pitch will be higher, N will be higher because it's inversely proportional. But during puberty, vocal cord mass length increases, the pitch reduces, because again it's inversely proportional, N is equal to 1 by 2 L T by M. So I don't give new mass, I don't give new length. What nature has given, those kind of patient will not effectively vibrating the vocal cords, so they are not using the whole mass and the whole length. So vibrating mass and vibrating length is less. But once I will stimulate whole mass and the whole length of the vocal cord, so vibrating mass will increase, vibrating length will increase, means M and L will increase, the N will reduce. So this is the simple biophysics behind the problem. And of course, all the high pitch voices not Puberphonia, that I will discuss later. So, and then first we stabilize this new voice in the phonation, and then we transfer to the conversation stage step by step. So I just discussed high pitch voice signs, symptom, cause and treatment, and let's move to the next topic, and that is there any side effect of voice therapy? So if you are taking voice therapy from a certified professional who are expert in the communication disorder, especially in the voice disorder, there is no side effect. Self-treatment sometimes damage voice and the vocal cord. I have seen that the phonatory gap, vocal nodule, and even they have those taken treatment from the healthcare quacks, they also developed as like phonatory gap and the vocal nodule. And one case I found, he developed the vocal cord paralysis. So be careful while taking voice therapy. You have to find the credential of the therapist. And next is how to contact us. So in any of our live video or any normal video, if you will explore the description of the video, you will find our website. On the website, once you will click, you will find our email ID. On Google Map, where is the clinic address, contact number, so all the details. So please explore our YouTube channels, any of the video or live description. And do we have accommodation facilities at our centers? Our center is not a hospital, it's a clinic. So we don't have accommodation facilities, but those who come from different places, we support to get the accommodation. And which treatment is preferred first, voice therapy or surgery for speech correction? So my suggestion is first you should try voice therapy, because if you are going for surgery like thyroplasty also, you have to take the voice therapy after thyroplasty. Then why not first voice therapy? So my suggestion is first you should try voice therapy for speech correction. And for example, if you have tried voice therapy from one speech pathologist and it didn't work, it doesn't mean that you are not a good candidate for the voice therapy. Because we have seen that sometimes some patient will take, even from certified professional, the voice therapy, and it didn't work, and they come to here at our center and they improved. It means the person to whom you contacted earlier for the voice therapy, or that speech pathologist may be the expert in delayed speech and language among small children, or maybe he may be expert in dysphagia and suppose swallowing disorder or some other communication disorder, but not in the voice disorder. So because voice problems, such kind of problem are not very common. So that's why maybe the therapy didn't work. But once you explore those people who are really expert in the voice disorder, and if it is not working, then only you should think you are not a good candidate for the voice therapy. And then, so if voice therapy has not worked from taking therapy from one professional, immediately don't go for thyroplasty or for surgery. And I have seen that after surgery, after thyroplasty, you have to take voice therapy to get stable voice or good voice. And there is always risk when you are going for thyroplasty and all. And voice therapy is non-invasive procedure. So if it works, it's fine. If it doesn't work, it is not going to be harmful also, if you are taking therapy from certified professional. So next is, do we have any branch of our centers? Till now, we don't have any branch of our center. Our center is only one, and that is in Bangalore. And that location is already mentioned at our website, and website detail you'll be able to find in the description of this video. And the cost and duration of the treatment for voice and speech disorder. So that varies, depends upon the communication disorder. So we suggest those who want to know the information about the cost and duration, expected outcome, we suggest those people to call us. First step will be doing perceptual evaluation. If needed, we'll be suggesting certain tests like stroboscopy or laryngoscopy. And sometimes we don't suggest any test. Just by listening the voice, we give some idea. So our suggestion is to know the duration, to know the cost, expected outcome, please call us. Because I have seen that sometimes patient will say that I have a stammering or a stuttering, and when we do the evaluation at our center, we find he's having misarticulation. So we don't believe on the patient self-evaluation or self-assessment. We do our evaluation, then we give the expected outcome, treatment cost and duration, etc. information. And next is, how do we treat international patient online or offline? So we treat our international patient in both ways, online as well as offline. But after perceptual evaluation or certain test completion, we decide who can be what kind of candidate, either online or offline. And next was saying 1, 2, 3, or saying patients should able to talk at conversation level, not only the words level, like how we are talking in sentences in that way. So if that is not there, you should not get impressed by those video and those social medias, whatever the informations are available. And especially in Indian context, must find RCI-CRR number to know that he is a certified professional or not. That already I have explained in the beginning of this live. And is voice therapy result is permanent? So it's a very, very interesting question. So there are certain communication disorders, especially spasmodic dysphonia or stammering. I have seen that after my treatment also in some cases relapse will be there. But especially in the speech correction, vocal cord paralysis or other communication disorder, I have seen that once we have done the treatment and the patient body responded, so whatever the change was there, that was stable. And to give that answer during the COVID pandemic time, I was free. Many of the patients were also free. So I did live with them, those patients whom we treated 6 years back, 7 years back. and they have given their experience, the new voice was stable or not. Usually, I in my YouTube channel comments, I reply the patient, watch this 35 minutes video. If you watch that 35 minutes video's description, I have given the link of those many patients to whom we did live and their feedback after 6 years, 7 years, 5 years, how their voice was stable or not. So I'm not going to tell. If you explore those who want to know. And next is effect of food and drink on voice. So what you are eating, what you are drinking, that also having the impact on your voice. If you take very cold or very hot things, that affect your voice or vocal cords. So if you want to maintain your very good voice, so avoid very cold or very hot thing. And even after the dinner, don't go to the bed immediately. Have a 1.5 hour to 2 hours gap between your dinner time and sleeping time, because once you take dinner, immediately go to the bed, what will happen? The acid which will form in the digestion of the food will accumulate at the throat level, and that may damage your voice and the vocal cords. So don't sleep immediately after dinner. And next is, who are the good candidate for the voice therapy? So I tell always in my live and in my many of videos, before starting the voice therapy, if you are a patient having communication disorder, especially the voice disorder, thinking that it is going to be a wastage of time and money, so I say you are absolutely right, you are correct. And if you think it's going to help me, it's going to improve my communication and voice, then also you are absolutely right. So conclusion is, if you have the motivation, that is going to affect the treatment results. So if you don't have the motivation, give some more time to yourself before contacting us, before taking treatment for us. So once your motivation level is at that level, then only you should contact us. And is all high pitch is all high pitch voice or female voice is puberphonia? Before answering this question, even I have telling you, even we have seen that more failure in the patients, those who tried before contacting us, either self-treatment or taken treatment from healthcare quacks, or sometimes some patients will take voice therapy from surgeon also. So just you can imagine, if I'll start doing surgery, what is going to happen with the patient life? I'm not training the surgeon. So opposite is also true. If surgeon is starting and giving voice therapy due to unemployment, so what is going to happen with the patient? You can imagine. So those kind of patient, I have seen that less improvement, or even sometimes I was not helped to those patients who tried either self-treatment or treatment from healthcare quacks or from the other background people. Those are not voice therapy. They are healthcare professionals, but they have not studied the speech pathology and audiology, and they are giving voice therapy. So in that cases also, I was not able to help. I was not able to help much to those patients. Next is, all high pitched voice or female voice is puberphonia. So answer is no. All high pitched voice are not puberphonia. High pitched voice can be seen in case of sulcus vocalis also, where nature has not given sufficient mass in the length of the vocal cord. In case of phonatory gap also, we have seen high pitched voice. In case of muscle tension dysphonia also, we have seen high pitched voice. So all high pitched voice are not puberphonia, and in extreme case there can be hormonal issues also. So proper evaluation by a certified professional like a speech pathologist is very, very important to understand what could be the reason, and then accordingly the treatment we plan. And online facilities for communication disorder at our center, that is the next topic. So we provide online voice therapy, online speech therapy for certain communication disorder, but who will be the good candidate for online voice therapy? After perceptual evaluation we decide, or sometimes we suggest certain tests after that only. And next is tips to keep your voice healthy. So drink plenty of water, even if you have the voice problem and even you don't have the voice problem. 8 to 10 glass of water is a very good, about 10 to 12 glass, I can say that very good idea to that much drink water. And avoid frequent throat clearing. Don't do like very frequently. If you do frequent throat clearing, there will be a lot of friction between the vocal cord, and that may damage your voice and the vocal cord. If you are a professional voice user, for example, you are a teacher and the classroom is very big, so ask your management to provide the amplification device, because to make your voice to reach to the last bench of the student, you need to put an extra pressure at the level of the vocal cord, and that may damage your voice and vocal cord. That is stress. So ask your management to provide the amplification device. And if background noise is very high, avoid to speak less, because you need to put a stress on the vocal cord to make your voice more louder. So that also you can avoid. And if you have any voice problem for more than 2 weeks, to just meet the healthcare professional who are expert in this area. Because sometime in the cough and cold also you'll be having some voice problems. So that is a natural thing of once the infection will be over and the voice will be back. So that time you should not be panic. But if the problem persists, voice problem persists for more than 2 weeks, so the reason, to understand the reason, you should contact the certified professional. And if you have allergy from certain things, so avoid those allergens and avoid to take very cold or very hot thing to keep your voice more healthy for long duration. And do some physical exercise like walking, jogging, so that will provide good stamina in your body and that will support in your voice also. So these are the few things I wanted to share for awareness. And the information is, those who are watching this live, don't forget to watch post-treatment live also. We'll be doing in the future of Ivan. And so please subscribe our YouTube channel and don't forget to watch and press the bell icon also. And next we'll be replying the question from the live chat. So now I am free, so I'll be seeing what questions people have asked. So I'll be giving answer. So I am now free. The one question is Om Jat. He's saying, I want online therapy. So Om Jat's suggestion for you is, please call us and we'll do perceptual evaluation, and then we'll be telling to you, you can be a good candidate for online voice therapy or offline voice therapy. So thanks for the asking question. And Santosh Kumar is saying, अपना कॉन्टेक्ट नंबर भेज सकते हैं सर? तो संतोष कुमार जी, हमारा कॉन्टेक्ट नंबर इस लाइव वीडियो के डिस्क्रिप्शन में मिल जाएगा. इस लाइव वीडियो के डिस्क्रिप्शन में जाइए, आपको हमारा वेबसाइट मिलेगा. वेबसाइट को क्लिक कीजिए, फिर रिच मी पर जाएंगे तो वहाँ पे हमारा ईमेल आईडी, कॉन्टेक्ट नंबर, गूगल मैप पे क्लिनिक कहाँ पे सिचुएटेड है, सारी जानकारियाँ मिलेंगी. एंड सो थैंक यू ऑल फॉर ज्वाइनिंग अस एंड वॉचिंग अस. और कुछ भी क्वेश्चन है आप पूछ सकते हैं. तब तक देन आई विल बी आस्किंग Ivan. So there may be some new people has joined. So please tell us what exactly problem you are having, why you contacted us, and where you stay. Unmute your mic.
Hi, I have very high-pitched voice. That's why I contacted Dr. Kumar. I hope we can do a successful treatment and have just a normal masculine voice.
Why you decided online voice therapy?
Because I don't want to be mistaken as a woman when I have telephone conversations.
So in which country you stay at present?
I live in Bulgaria, Eastern Europe.
Okay, Bulgaria, and I'm in Bangalore, India. Okay, so in spite of that, you have shown faith in us, and of course, we'll be helping you by online voice therapy. And those who are having the curiosity after treatment, what happened to the Ivan voice? So please subscribe our YouTube channel, press the bell icon, so that once in the future we'll be live again after treatment, so you can see the difference. It's helping or not to get that answer. And I'll be just seeing any questions are there. I'll be answering. So thank you all for joining us and watching us. If you have any question, if you have any suggestion, so please write in the comment box and we'll be giving the answer. Those are watching this live. So thank you all. Love you all. And thanks Om Jat for asking question. Thanks Santosh Kumar for asking question. Thank you all. Love you all. We'll stop this live now.